ready to be part of an elite business network shaping a more prosperous Western Hemisphere. Founded nearly 60 years ago by David Rockefeller, Council of the Americas can be your gateway to new markets, better relationships, and a deeper understanding of Latin America.
It's incredible, the agenda that you put together. It's really uncommon to see the discussions about technology in which the CEOs of very large corporations are the ones presenting.
Very good insights, and most importantly, developing relationships and understanding how can we work together for the future of the region.
Through more than 160 private events and conferences in 8 countries last year alone, our members engage with government officials, CEOs, and top experts, building solutions to the most critical issues affecting the region. Whether meeting presidents and ministers in our New York, Washington, or Miami offices, joining exclusive and industry-focused missions to Latin American countries, or being part of CEO and CFO forums happening across the region, our community of more than 200 corporate members shapes substantive dialogue on topics such as artificial intelligence, healthcare, and sustainability in the Americas.
When you become an individual member of the Council of the Americas, you really have this access to people in the private sector, people in the public sector, in a way that would be very difficult to replicate elsewhere.
Share strategies at our symposium and Bravo leadership forums with hundreds of senior business and government leaders gathering in Miami. Learn about what's framing U.S. policy on trade, energy, and democracy in the region at the Washington Conference on the Americas. And get fresh insights on regional events from influential voices in America's Quarterly.
The richness of our content doesn't just come from a minister or a president sitting and talking to our members. It comes from listening to everyone at the table. What sets us apart is our ability to bring everyone together. You build new relationships face to face.
The Council is a constant in the sense that administrations and governments come and go, but the Council is always there.
This is an opportunity for companies and countries of Latin America to come together and engage. And engagement is the most important thing to understand one another.
Join us. We connect the Americas.
Let's begin our program today. Good morning, everybody. Welcome to the Council of the Americas. It's a real pleasure to have all of you with us. My name's Eric Farnsworth. I head the Washington office of the Council of the Americas, and it's a real privilege and a pleasure to be your host for what promises to be a very stimulating conversation. Self-care in Latin America, improving and supporting healthcare system sustainability. It's a topic that we all know something about, but it's, I think, going to be a really important conversation to figure out what can private sector, public sector do together to really promote these very important issues. This program is very timely because it marks the beginning, indeed, of Self-Care Month. How many of us knew that there was such a thing as Self-Care Month? Well, there is. And this program is designed to highlight that and promote the ideas therein. And again, we're looking forward to having this conversation. We've got a great lineup of speakers, and we're going to get to them in just a moment. But let me just say that this event is part of the Council of the Americas and Americas Society Healthcare Dialogues. The dialogues bring together member companies and others to address key challenges across the healthcare sector and to assess opportunities for growth throughout Latin America and the Caribbean and Canada and North America as well. I'd like to take this opportunity to acknowledge and express our sincere gratitude to the sponsors of our healthcare dialogues. Indeed, we couldn't do this without their support. And those companies include Amgen, Johnson & Johnson, Kenvue, Merck, which is MSD outside the United States, Organon, Pfizer, and Sanofi. And if we were together in person, I would ask for a round of applause for their support. We'll give them virtual applause and good thoughts for their support. We'd like to encourage all of those who have not been part of our healthcare activities here at the Council to consider joining us and attend some of our activities, see if it suits your needs, and to work with us to try to promote good healthcare in the Americas. As I mentioned, this timely presentation and panel discussion marks the beginning of Self-Care Month, and according to the Global Self-Care Federation, self-care is the practice of individuals looking after their own health using the knowledge and information available to them. It's a decision-making process that empowers individuals to look after their own health efficiently and conveniently in collaboration with health and social care professionals as needed. Among the benefits, self-care contributes to reducing the duration and severity of non-serious conditions, and it provides economic and social benefits for individuals, communities, and health systems. And lest you think that we're just making this up, in the context of Latin America, self-care demonstrates significant achievements, saving approximately, well, actually over $7 billion annually for health systems in the region. That's real money. However, results from studies in different countries in the region indicate the need to continue promoting a strong self-care strategy for the benefit of the people and for healthcare systems, which we know have been stressed coming out of the pandemic and frankly need all the help that they can. Today, our group of experts is going to discuss the value of self-care policies, give us an overview of the opportunities and challenges for promoting self-care in Latin America, and share their ideas for collaboration. We've got a great group of panelists joining us, each bringing their unique perspectives and expertise on this topic. Before we get to their introductions, let me encourage all of you who are joining us on this Zoom presentation to participate actively. If you have thoughts or questions that you would like the panelists to answer after their presentations, please submit those in the chat, and we'll do our best to address them during the Q&A session. So let's begin our journey into self-care. Our panelists include, our first panelist will be Deputy Flávia Morais, who is a Brazilian deputy. She's recently presented a bill to the Chamber of Deputies and was approved, which creates a national self-care policy in Brazil with the aim of reinforcing the importance of individual action in the promotion, prevention, and recovery of health. Dr. Morais has submitted a bespoke video that she created just for this program, which we'll show in just a minute. She'll be followed by Judy Stenmark, who's the Director General of the Global Self-Care Federation. And Dr. Stenmark will be followed by Professor Dr. Uwe May, who is the Dean of Studies at Fresenius University of Applied Sciences in Germany. All of their biographic information is on our website, www.as-coa.org, and we've also linked it on this chat so that you can conveniently locate it. Our other panelist actually took sick late last night, so she won't be able to join us. I guess she didn't take care of herself. That's a bad joke, ladies and gentlemen. Let's get to the video by Dr. Morais, and we'll begin our program. Thanks again for joining us.
Bom dia a todos, aqui é a deputada federal Flávia Morais. Eu queria cumprimentar a todos os organizadores e apoiadores do evento. Para mim, é uma honra poder representar o Brasil como deputada federal nesse evento tão relevante para o futuro da saúde e do autocuidado, realizado em um momento tão oportuno, quando mundialmente já é iniciada uma série de ações pelo Dia Mundial do Autocuidado, que é celebrado dia 24 de julho. Peço antecipadamente desculpas por não poder estar ao vivo, mas fiz questão de deixar o meu conteúdo e dividir com os participantes a minha visão sobre o autocuidado, em especial por ser autora do primeiro projeto de lei do Brasil que sugere a criação de uma política nacional de autocuidado no âmbito do Sistema Único de Saúde, o SUS. A minha atuação junto ao Parlamento tem sido frente à assistência social, à saúde, direitos humanos, direitos das mulheres, das crianças e dos adolescentes. Também com as pautas das pessoas com diabetes e câncer, essas últimas relacionadas diretamente com o tema do autocuidado, que promove a prevenção e pode evitar o agravo de novos casos dessas doenças no Brasil e no mundo. Eu sou autora do projeto de lei 2687, que classifica o diabetes tipo 1 como deficiência, assim como já acontece em países como Estados Unidos, Reino Unido, Espanha e Alemanha. Na última semana, inclusive, a meu pedido, a Comissão de Saúde realizou um importante debate sobre as novas tecnologias para o tratamento do diabetes. já que o diabetes é uma doença crônica que afeta cerca de 16,8 milhões de brasileiros, representando uma importante parte da população. Poder falar em promoção do autocuidado como oportunidade para a melhoria da saúde da população é primordial, ainda mais em um país de dimensões continentais como o Brasil, onde vivem mais de 215 milhões de brasileiros. E em cada 10, 7 brasileiros dependem exclusivamente do SUS para tratamento de saúde. Seguindo tendências mundiais, a pauta do autocuidado é uma discussão crescente no Brasil. Estou atenta a isso, aprendendo muito junto com os senhores atuando. Esse tema pode vir a ser uma grande oportunidade para que o Brasil, no ano em que este país está presidindo o G20, possa, com certeza, disseminar ainda mais esse tema. O Grupo de Trabalho de Saúde do G20, coordenado pelo Ministério da Saúde, tem como destaques a construção de sistemas de saúde resilientes, como forma de alcançar os objetivos do desenvolvimento sustentável. Dentre eles, estão o fortalecimento dos sistemas nacionais de saúde inclusivos, eficientes e de qualidade, com ênfase na atenção primária à saúde, e a construção de propostas que promovam a redução das desigualdades em saúde, ou seja, temas diretamente conectados à pauta do autocuidado. O poder público tem desafio de administrar os impactos da transição epidemiológica na gestão da saúde, principalmente quando falamos do SUS, sistema universal, gratuito e com abrangência continental. O autocuidado reduz significativamente os custos de saúde. Estima-se que a prática do autocuidado pode economizar cerca de 119 bilhões de dólares em custos de saúde anualmente. Segundo os dados do The Global Social Economic Value of Self-Care de 2022, essa otimização libera recursos que podem ser alocados em outras áreas essenciais do sistema de saúde. O autocuidado economiza tempo também, e muitas horas. Quando os indivíduos praticam autocuidado, tratando eles mesmos de problemas menores, que não necessariamente dependam de um atendimento médico profissional, estima-se que aproximadamente 11 bilhões de horas sejam economizadas anualmente para os indivíduos e 1,8 bilhões de horas para os profissionais de saúde. Acreditamos que o autocuidado é mais do que importante para o sistema de saúde, mas efetivamente é um dos fundamentos para a sua sustentabilidade. Devemos mostrar à sociedade como sua qualidade de vida também depende de suas ações e hábitos. Portanto, a prestação de informações e conhecimento para melhores práticas de autocuidado, promoção de saúde e prevenção de doenças também deve ser um dever do poder público. Dessa forma, o Legislativo tem assumido a frente em promover a agenda do autocuidado como uma política nacional. Nesse mês, a Comissão de Saúde aprovou um projeto de lei do Dia do Autocuidado e, em conjunto, outros 2 projetos de lei de minha autoria. O PL 939 de 2024, que determina o estímulo ao autocuidado no âmbito do Sistema Único de Saúde. E o PL 948 de 2024, que cria a Política Nacional de Autocuidado com o objetivo de reforçar a importância da ação individual na promoção, prevenção e recuperação da saúde. Nessa minha proposta sobre a Política Nacional do Autocuidado, defendo que seja feito o fortalecimento do papel das famílias e dos indivíduos para o uso racional de produtos e serviços de saúde. A prática de atividade física, alimentação saudável e hábitos de higiene são fundamentais. A disseminação de informações sobre saúde por fontes confiáveis. A conscientização sobre produtos e hábitos de saúde, bons hábitos de saúde. O fortalecimento da atenção primária no âmbito do Sistema Único de Saúde. O uso amplo dos recursos de saúde digital para otimizar a prevenção, diagnóstico precoce e acompanhamento de condições crônicas. Sigo confiante de que os nossos colegas parlamentares vão dar continuidade e andamento a essa pauta na casa. Em breve estará na Comissão de Constituição e Justiça, estará sendo aprovado, depois vai para o Senado, estaremos acompanhando e garantindo que nós estaremos fazendo a nossa parte para que o Brasil esteja acompanhando essa discussão mundial. Quero mais uma vez agradecer a oportunidade de participar aqui, poder trazer as nossas realidades aqui do nosso Brasil e sigo à disposição, por meio do meu gabinete, caso os convidados queiram direcionar perguntas diretamente à minha equipe. Muito obrigada e um excelente evento a todos vocês.
I want to thank Deputy Morais for those very important comments, and she made several important points, but the one that particularly caught my eye from the cost perspective is you have a government that guarantees healthcare services to its population, and a country like Brazil is truly continental size. How do you do that in a cost-effective way without a better sense of self-care and taking care of issues as they arrive at the local level and indeed at the individual and personal level to the extent possible? It's a really important point. And I think our two next panelists will be adding to this conversation very effectively. So I'd like to bring on Judy Stenmark, who I mentioned is the Director General of the Global Self-Care Federation in Switzerland. She joins us all the way from several time zones away. It's really a pleasure.
It's still daylight.
For your presentation, you're good to join us. And then after your thoughts, we'll turn to Dr. May. So Judy, please, to you.
Okay, so I don't have any slides, but first of all, I'd like to congratulate Dr. Morais for everything that she's done, because Brazil in Latin America is really, way ahead of the curve, if you like, in terms of what they're doing, and having that one of the first bills, and also Mexico recently introduced a bill as well, which is great. Only problem is all these countries that are doing great things, and they have elections, and certain people leave. But I think she is a great contact for all of us in Latin America. So I think you gave a very nice definition of self-care. And there are many definitions of self-care, and people have many different views of self-care. And look, for us, to put it simply, self-care is people becoming active self-managers of their own health, doing what it takes, becoming health literate, getting information, talking to the pharmacist. It might involve doing exercise. It might involve using over-the-counter products like anti-inflammatories for their osteoarthritic hips, but it's doing things to help themselves, sometimes with a health professional, sometimes without. And I think, Eric, you really hit the nail on the head when you talked about COVID, because COVID has shone a spotlight on a lot of things, the fragility of healthcare systems, and it also shone a positive spotlight on self-care, because for many people, that was all they had. And it showed self-care in a very positive light. And in fact, WHO made a number of positive statements about self-care during that period. It also shone a really positive spotlight on the pharmacist as a trusted, underutilized source very often of self-care, of information. So it changed a lot the way pharmacists act, and also the global bodies, in fact, because governments realized, hey, we don't use pharmacists as we should, and they're a great resource. And in fact, I was on a webinar last week with FIP, which is the International Pharmacist Group. And in fact, we were talking about this. We're also talking about the fact that if pharmacists are going to spend more time giving people the energy and advice they need, then somehow they need to build that into their day. But that's another story. But getting back to self-care, becoming active self-managers of your health. And the definition of self-care. So taking time for yourself is incredibly important. And that might mean having a nice bath in the evening, lighting some scented candles. That's a very nice thing to do, and especially taking time out for yourself. But that's not really what we're talking about when we talk about self-care. It is looking after yourself, but we're talking about taking steps, whatever they may be, using whatever device, product, etc., utilizing healthcare professionals as needed to manage your own health. And a lot of this is for minor conditions. So if you've got a serious infectious disease, you have cancer, that sort of thing, then of course you need the help and guidance of a healthcare professional. But self-care, we have evidence now where self-care is a major pillar of the management of things like non-communicable diseases, or NCDs. And they're one of the biggest or the major costs to us and our health systems around the world. So there are a few things. I don't want to talk in, little pithy little statements, but We've done a lot of work about how self-care drives and supports UHC. And in fact, a lot of the guts, if you like, of the Sao Paulo Declaration on self-care was for UHC, for advancing UHC. So I think we can talk about that more, I guess, a bit later. And also just wanted to touch on health literacy, whether we'll talk about that later, but we often say there is no self-care without health literacy. So people becoming health literate, however, whatever means that might take. So digital tools, for example, so that people become more health literate. And for us, things like e-labeling. So around the world, people still buy, let's say, a box of paracetamol or an anti-inflammatory box, and it's got a huge piece of paper in it that folds out into many languages. And what's the first thing you do? Because probably, as all adults say over 40, we've all used those before, you pick it up and you throw it in the recycling because you don't need it and you can't get the blister pack back in. So e-labeling saves the environment, but it's also, it's very translatable, and everyone has a mobile phone nearly, no matter what age you are, and you don't need computers for it. So I think in terms of enhancing health literacy around what you could be doing, whether it's an over-the-counter product or whether it's some other thing that someone's recommended to you, I think e-labeling in terms of enhancing health literacy is a major thing. And I will just finish on my opening remarks. It was nice that Dr. Morais mentioned our global study that Uwe, no doubt, will talk about on, because Uwe May in the picture there and his partner Cosima Bauer did that study for us, the global study on the economic and social value of self-care. And that really highlighted some, in simple terms, self-care is good for people. It saves people time, it saves people money, it improves health outcomes. It's good for healthcare professionals. It saves them time. It saves them money, about 1.8 billion now in physician hours saved. And it saves government and health systems money. And that's very important, allowing them to spend more time servicing really critical care, and also healthcare professionals engaging in critical care for people who really need a lot of attention. And right now we know we're saving about, by engaging in self-care and all that means and all the ramifications, about $120 billion. And if we do more of it, we will save more. So I think I will stop there and then pass over to you and then Uwe, because no doubt he is going to talk about some of the details of that study.
Well, thank you very much, Judy. You raised several very important points, although the one I chuckled because when you were talking about pulling out that piece of paper in several languages, I thought you were going to say before the first thing you do is throw it out. I thought you were going to say the first thing for people over 40 is go get your reading glasses so you can actually see that, which is what I
find your glasses. You can't find your glasses, you're in big trouble, or you get your children read it if it's a new product.
I mean, you've got the child safe cap and then you've got the instructions you can't read. So I guess you're not supposed to actually use these things. No, I'm obviously kidding, but those are some very, very good comments. I want to come back to several of those points to the extent we'll have time, but let's move to Uwe May. Dr. May, you've been well introduced already, teed up, as we would say, for the study you've done. Talk to us a little bit about self-care from your perspective.
Yeah, thank you very much first for the invitation and for this warm welcome and for the introduction of the study and my person. Well, it was mentioned several times. We did a big research, a very comprehensive research project, a global project all over the world on the socioeconomic effects of self-care. The most learnings we had, because we had done a lot of research on topics of self-care, self-medication, switches from ICE to OTC and so on. But the most learnings we had, the most important learnings we had was about the low and middle income countries, because more or less all the studies that had been done before by any researchers anywhere in the world were kind of focused on high income countries of the, let me say, of the Western world. So that was quite new. Now I'm going to talk about, of course, the Latin Americas. South America, and focus on this and give you a very small view on what we did. Well, we started our research with a very comprehensive systematic literature review. Of course, we didn't find very much information about this kind of stuff from other parts, as I mentioned, from the Western world. There is only a little bit of work done for example, for Southern America and so on. But what we realized very quickly doing this research is that the way people self-medicate, the way people care for themselves, the reason why they do it, for example, is very different in all parts of the world. So what we saw is that, for example, in Latin America, many people, they practice self-care because they are just not able to pay for healthcare. They are not able to see a GP, for example, for several reasons, economic reasons, just practical reasons, like they have to travel in many regions quite far and so on. So that's one of the that's an important incentive and important motivation. Whereas in Europe, I think almost everybody has kind of access to GPs, to the public healthcare system. But here in Europe, self-care, and also in Northern America and other parts of the world, self-care is more considered as a way to release the burden on healthcare systems. So that was quite different. And that was why right at the start, we realized we have to define new concepts of how people treat themselves. So we developed this decision tree. Here we see an individual is suffering from a self-treatable condition, this STC. And look at this, what happens, this individual has the choice of doing self-care. That means, for example, using home remedies or OTC medicines, or seeing a physician. That's one alternative. The next choice would be just to do nothing, no treatment, wait and see. So on what we found is, what we defined is, first of all, of course, whatever you do, there is a result with regard to costs, direct costs for the healthcare system, indirect costs, but also a patient outcome, which might be quite different in these situations. And yeah, and what we saw is, well, some people, and this is more in the high income countries, they treat themselves as an alternative of seeing a physician. They have the chance, they would have the chance to see a physician, but they treat themselves. We call this idea self-care first. So if you treat yourself instead of seeing a GP, this is called self-care first for the rest of my presentation and for all of our study. This is this kind of concept. Whereas when you have the choice between, you just have the choice between doing self-care or wait and see, then we call this treatment rate. So this is the name of this concept, having just the choice to do nothing or to do self-care. Well, in the rich part of the world, in the high-income countries, as I said, almost everybody has access to self-care. People choose self-care to GPs. People then choose self-care to save time, and healthcare systems are released, and that kind of stuff. But in other regions, yeah, we were very familiar with all these studies showing what is the effect, how much cost when we say how much GP contacts can be saved by doing self-care. And then suddenly we try to find out, but what happens if we talk about a very poor country in the middle of Africa? What happens with self-care then? There is maybe no GP which can be saved. There are no GP contacts which can be saved. Does that mean that self-care doesn't have a value? It has, of course. Come to this. Last thing that was also mentioned, that was a third approach to self-care, is just to have let's say, a healthy lifestyle. It's a matter of prevention then, and this is what we call self-care behavior. We addressed this in the study, but we were not able to evaluate this in a health economic way. So this is now what we focus on is self-care first, doing self-care instead of seeing a GP, or doing self-care instead of doing nothing. And let's say the pillars that make up the social value of self-care, they are somehow depending on these concepts. One thing is very important: self-care can enhance the quality of life. So if you treat yourself, you're suffering from a migraine, and you treat yourself if you have fast access, for example, in self-care, then this is an effect on your quality of life. Second is, there is a very important effect on welfare. So people are able to go on working, to run their daily business because they did self-care. Then this is something that matters in terms of productivity, and this is also something that matters in your ability to do your personal duties, to care children and all these things. This is a matter of welfare. And last but not least, it's about cost containment. And that's what we were used to know. Well, we save GP contacts and so on. But for the middle and low income countries, the other two pillars are much more important. So we make the distinction and we make our calculations based on these difference between, are we in a concept self-care first, choosing self-care instead of GP, or are we in a concept self-care as an alternative to doing nothing? So that's why we did the calculations also with regard to these two concepts. So let's look at Southern America, at Latin America. We have a couple of countries here which are, according to World Bank criteria, high-income countries, for example, Argentina. Most countries and most people live in Group B, which are middle-income countries, and a few people live in Group C, which are low-income countries, like, for example, Honduras. Well, we did these calculations, self-care first. That means how much money was saved by people who choose self-care instead of GP, cost containment for the healthcare system, patients save time because they didn't wait for a GP and so on, and physicians save time. That's one thing. Here you see the figures. The other approach was to say, well, what was the effect of those who didn't have the choice to see a GP? What about their productivity if they choose self-care? What about their welfare, their personal economic welfare? I'm not talking about the welfare of the economy. I'm talking about personal welfare. And what about their quality of life? Because they had the chance to treat themselves. And here you see a couple of results. I know it's always difficult to understand this big figures, so this very large figures. So let's maybe look at this at a per capita level. Here you see the results for one person. You see how much money can be saved for the healthcare system by one person. And remember, we have millions and millions, hundreds of millions of people living here. It's about roughly 10 euros, and it's dollars, sorry, and it's different if you look at Group A, rich, or Group C, low income countries. Patient time savings are also different according to the environment where people live in, physician time savings. But what I want to focus your attention to is the effect when people treat themselves instead of doing nothing. So people individually, they win productivity. Like, for example, in Group B countries like Brazil, we have more than 4 days of productivity, which now are realized already. This is status quo, right? This is not a forecast. Now already people can generate more than 4 days of productivity by treating themselves. Their welfare is $136 higher than without self-care, and they win quality of life. If you are one of the poor guys suffering from migraine, for example, you know what I'm talking about. If you treat yourself, you win quality of life. This is an effect that can be measured. Health economists use this term like QALYs to measure this. So this is the thing. And what about the GPs that can be saved? As I said, there are not so many GP contacts in low and middle income countries like in Latin America, but nevertheless, there are GP contacts which are already saved right now in status quo because people treat themselves. Here are the figures. So you see, that means, in other words, roughly 60,000 GPs would be needed in addition if we wouldn't have self-care in Southern America. Make up your mind where these GPs should come from and who should pay for them. Right now, we save roughly 60,000 GPs in Latin America, even though we have not that many GPs as in other regions. In regions like Europe, you save much more GPs, and much more GPs are freed up. And of course, these GPs should care for for persons who suffer from really severe conditions and not from minor ailments, right? This is why this is such an important figure. Well, let's look into the future quickly. The future impact, we did these calculations all with regard to a 10-year perspective. So what is possible in 10 years? These figures all over now, you see we did this for all the regions in the world, might again not be very helpful for you. This is just to show you we did all these calculations. And you see the big differences, like, for example, cost containment in Latin America is 18 euros. These guys in Latin America, on average, they have 6 packages of OTCs, whereas in other regions, like in North America, this is more, or in Europe, it's more. So this is one of the drivers, of course, how many OTCs are taken, and then you have the effects, the positive effects. But again, it's about, for me, in this context today, it's very important to say it's about productivity of people. It's about personal welfare. And you see, this really matters, that people win almost 7 days or more than 6 days personally per capita by doing self-care. So this is what matters. And again, maybe it's even better to understand if we do this calculation for one OTC pack. So what is the effect on average by one OTC pack that is taken in the regions, like in Northern America, like in Europe and so on, but also like in Latin America. And you see here, every OTC pack, let me put it in this easy words, every OTC pack saves for the healthcare systems roughly 12 euros. Every pack that is sold right now in Latin America, every pack that is sold on average saves 12 minutes. I'm not saying that everybody who is now doing self-care would otherwise CGP. It's not that easy. But on average, if you take everything in your calculation that is needed, you find 12 minutes. And in the end, every package that is sold, every pack of OTC sold saves more than $45 welfare, right? Okay, we have this done, as I said, for all over the world, very different learnings from all over the world. This only a short look at this picture, just showing you for country group B, that means for countries like Brazil, like middle income countries. Here you can see where we are today. The gray bars show how much the effects are today, and the yellow ones show what is possible in future, in the next 10 years. So you can see, for example, the productivity days, we can almost double this, right? This bar, the gray bar, in future by enhancing the role of self-care. Just to give you an impression how important it is to do self-care policy in order to shape the conditions for self-care. Well, last but not least, a few words to the enablers. Well, as different as the concepts are for self-care and why people treat themselves or do not, as different are also the enablers in the different regions. So we found, of course, basically it's about access. People who want to treat themselves, they need access to products. That means products need access to markets. Medicines have to be available without a prescription, otherwise you can't treat yourself. And you need, of course, on-site outlets in the regions. That's access. Affordability. People must be able to pay, just to pay for these OTC drugs or for any drug at all. They must be able to do this on an individual level, maybe with the help of social systems. That's the second thing. And the last is action. We call it action. That means people really have the opportunity, but they should really choose self-care. What is the driver? We need individual incentives. And as I said, these 3 A's, they have a different weighting depending on the region we're looking at. So again, we have the South Americas, and here these pyramids show the weighting. So what I want to say is that in country group C, in the very poor countries like Honduras, Nicaragua, it's all about access. You don't need incentives for people to do self-care. It's about access. They need access for this. In in the high-income countries like Argentina, it's more about the right incentives. These people, in many cases, they can choose to see a GP, but what are the right incentives not to see a GP in case of a minor ailment? That's what it's all about. You know, Southern America is almost in the middle. Most countries are in the middle of these two, in between, and therefore we need a mixture of this. And of course, also please take to your mind that when we talk about a country like Brazil, which is a middle-income country, in this country you have millions of people being high-income persons. We have also in the same country millions of people being rather poor. So we need this kind of mixture of policies, not only between different countries, but also in the country itself. And it's about, as I said, in most regions, like the low-income regions, and it's all about market access, give incentives for companies to be in the market and make these products available for people on site, give them the choice. That's roughly in very short terms, the political message of this. So I guess I was talking a bit longer than I was allowed to. Sorry for this. So many informations I would like to share with you, and yeah.
Well, that was very, very nice. No, thank you, Uwe. That was really good. You gave us a lot to think about. What I really particularly liked was you not just gave us the macro level, impact in terms of financial issues, but at the personal and individual level as well. It matters to people. It doesn't just matter to economies, right? And I think that's a critically important point. And you also raised the point, which is so relevant across Latin America. I mean, so often we aggregate numbers. For example, this country is middle income, that country is higher income. But within those countries themselves, there are pockets of lower income. So for example, Brazil, you have the entire Northeast or Amazonas, right? Which is not high income. So these are really important points. I really appreciate that you brought them to our attention. A reminder to those who are watching on screen, if you have a question for our panelists, please feel free to put that into the Q&A or the chat, and we will endeavor to get to those. But let me turn back now to Judy Stenmark. Judy, you mentioned the Sao Paulo Declaration, and you teased that out a little bit for us, and you said you wanted to talk about that later. So let's give you that opportunity now to talk about what is the Sao Paulo Declaration, why is it important, and is some of this, look, some of the folks listening in, watching these very impressive presentations might be thinking, some of this is just common sense. Why do we need government policies to talk about this stuff? Why do we need, Sao Paulo declarations? Judy, enlighten us on that front.
Okay, so I'm going to show you the Sao Paulo Declaration here. I just took it off my office wall. So this was what we launched at our meeting in Sao Paulo, regional meeting in Sao Paulo in November last year. So we had 1, 2, 3, 4, 5, 6, 7 governments in the region sign up to this, and we've actually had more since then. And we just met briefly during the World Health Assembly in Geneva, it's held every year, to discuss exactly this. So this declaration was all about self-care supporting UHC, or universal health coverage. So it was obviously written in kind of UN speak about recognizing, agreeing, and considering all the evidence for self-care beneficial for individuals, health systems, and healthcare professionals, and then acknowledging the importance of changing policy. So the important thing really is that they declared their commitments to promote self-care for primary healthcare and UHC, which is incredibly important. Supporting education and awareness. Now that includes fostering health literacy, leveraging technology and digital solutions. And that's interesting that we put this in here and everyone wanted that in there. So again, digital solutions, not just e-labeling that I mentioned, but other solutions for people of all ages. And we can't forget about older people who aren't on their laptops all the time. So, AI is around and we need to look at those considerations. But collaborations and partnerships, and I think that's incredibly important, and I'll talk about that in a sec. Equity and inclusivity, and that's, again, this thing of leaving no one behind. But, Uwe is pointing out in some countries where there is nothing available. And self-care and managing your own health is all you've got. for various reasons. So we have to make sure we are inclusive and that everyone has access. This is what WHO is about. Everyone has access, or the potential to have access to care, to the care they want, and advocating for better self-governance and monitoring process and progress and accountability. So what this is all about, Eric, is supporting a WHO resolution on self-care. So that has been one of our primary objectives and policy objectives, I would say, the last 18 months of the Federation. And I was just on another webinar with the Self-Care Trailblazer Group in Africa. And why do we want that? Because self-care right now really doesn't have the legitimacy that we think it deserves. There are people who are like, oh yes, self-care, and governments, etc. And that's why we got Uwe and Cosima to, first of all, do this research for us, because we need to show, okay, well, everyone says self-care is important. How important is it? What will it do for me, for my government? And what will it do for my mother? And what will it do for, will it save money? Will it save time? Will it save me time going to the doctors? So that's why we did that study. And before that study, the year before, we did the Self-Care Readiness Index 1 and 2. And we did that in collaboration with WHO as well, to look at what are the key enablers for self-care in any country. And Brazil and Colombia have been included in those. So why do we want a resolution? We want a WHO resolution on self-care so that we can get self-care embedded in public policy, so that we can really then move the needle. Because we think that if we don't get that, that eventually all this effort we're putting in, may lead to, we don't know what. Now, obviously, there are many other considerations. And, environment is a big consideration. We do a lot on environmental sustainability for things like packs of OTCs and other things. And that's incredibly important, but that's also part of self-care as well. So I'm not going to go too much into the weeds, but we are trying to get member states, including Brazil, to support a resolution and to support it and send their note into WHO before September 1. So for any health department people who may be online, please send a message to Eric or Maria, and we can be in contact.
Well,
so,
just send them a copy of a link to this terrific panel discussion.
Okay, so I think I should stop there.
No, that's fantastic. Thank you. And let's turn to Dr. May. And, the question I was going to ask you, Dr. May, you mentioned incentives in your presentation, which I think is key for any human behavior. How do you encourage certain behavior, discourage other behavior? But there's a very provocative question that came in on the Q&A, which I'd like to also throw at you to the extent you're willing to address it. And the question is, how do we ensure that self-care doesn't become self-medication? In other words, how do we ensure that it doesn't go too far, or that it's used in a way that ultimately causes harm, right? And we can think about various examples and addictions and things like this. I think it's a really important question that we do have to raise. I don't know that there's an answer for it or not. What are your thoughts about those two questions? Incentives, and then how do we make sure this doesn't go too far?
Yeah, maybe, please don't misunderstand me about the incentive. The incentive is not to use as much OTC products or self-medication as possible. It's only about the matter when you suffer from a minor disease, let's say a normal cold or something, or some headache or whatever, and you are aware of the problem, the problem, that you are able to self-diagnose yourself, you have often done this, you are familiar with the problem. Well, then the question is, now I need a medicine, I need a drug. So what are the ways I can choose? I can see a GP, and that's what very often happens in the Western European countries. GP contacts are for free, prescriptions are also for free. That's like the situation here, rather situation, for example, in Germany. So many people who have time enough, they decide, well, I'm gonna see a GP. I've been waiting in the GP's office, reading the latest newspapers, and after a while, I get the contact, I get a prescription. This process is about 60 euros for the German healthcare system in order to get a drug which costs you 6 or 7 euros on average. So there is a wrong incentive. I want just access to this drug, but I put costs of more than 50, 60 euros on the system. There's a wrong incentive. For us individually, it might be the right incentive, but not for the society as a whole. So there we need the right incentive. And this is not about kind of over medication. It's more about in the situation where you need a drug, then choose the right way. If you really want to be diagnosed, if you need more information, if you feel unsafe, see a GP, of course. So this is also about incentives. We also don't need negative incentives. We could just say, well, let's for example, in Ireland, you pay roughly 60 euros if you see a GP. It's also a European country, but it's different. Of course, there's a strong incentive not to see a GP. There is also a risk in this. Maybe people choose self-care because it's cheaper, but in the end, they have a problem. So, and when you're talking about the safety aspect, I mean, we did at the beginning, let's say 10 years ago, when we started with this, we did a lot of research about the question, what is about this? Is there really a risk? Are we running a high risk? But the answer is no. We have a lot of experience all over the world in safety of the product, and those products who are available as OTC, they are safe in this context. They are made for people to self-medicate them. Otherwise, they are not. I think Judy might put it in much better words, but it's about it's about this. OTC products are made for self-medication, and we know that people are very careful with this. Let me put it like this. I'm a scientist, right? There is no evidence at all that we ever found that people are running a higher risk doing self-medication. You find single cases, of course, for everything. You find people misusing aspirin or whatever, but you have to compare it to the alternative, and most drugs which are misused, sorry for this, but are prescribed by GPs. So on average, we find from a scientific perspective, there is no evidence for this. And of course, we have to be careful at the borderline of self-care to RX, but I think it's more a question for you, Judy, right?
Yeah, I think you answered it very well, Uwe. But just to say, as you said, there is a reason these products are OTCs or over the counter. There's a very good reason for that. They've been around for many, many years in the community, and that's what you need with any sort of medication, that it is being used for many years by many people, so you can see what are the possible side effects. And so I would just say there is a reason why these are OTCs. And as Uwe said, they're always individual cases, but the risk of, addiction and harm is really with prescription medications, and that, of course, is an issue if people misuse. And I guess to just point out that we are all about the appropriate use of, let's call it self-medication or over-the-counter or self-care. There's a reason we often don't use the term self-medication, because people have different connotations about self-medicating themselves, and even joke about it. So when we talk about self-care, and self-care isn't just about over-the-counter products, it's about other things. It's about using devices. It's about making sure if you've got high blood pressure, you take your blood pressure. You use diabetic testing kits, that sort of thing. So you engage in meaningful exercise to help with your issues. So I think, that's all I've got to say on that.
Yeah, I think that's an important point. It's we're talking about a wide range of activities, healthy eating, exercise, going to the doctor when you need to, but being aware of you can, I think this is important, but it's an important question that's on the minds of folks, and I'm glad that you're.
Oh, definitely.
Absolutely. Dr. May, is your study Yeah, go ahead. Go
Just
ahead.
one remark on this.
Yeah, please.
I mean, what I really didn't mention is, of course, and I think Judy mentioned already, it's all about health literacy, of course. I mean,
Yeah.
the availability of OTC drugs has to follow the level of health literacy. When you have more informed people, then yeah, they are more able to decide. This is one point, and the other thing is, if you talk about the risks of doing self-medication, you have to compare them to the risk of getting GP drugs, but also to the risk of doing nothing. And this is, in many cases, neglected. What happens if you do just nothing? You are also running risks in this. And if we do this comparison, then we have to do it completely, and not just pointing out there is a risk if 1 in 1,000 persons takes too much aspirin. That's too short.
Yeah, good point. Is your study published, or will it be published? Do you have any sense on that?
It is already published. It will be published more. We did an article in a peer review journal, and we are working on more of this. So the method is already published, and we did several comparable studies with these kind of methods, for example, also for the European organization, and they are published. So it's on a sound scientific basis, I would say.
No, there's a question in the chat. So,
and Derek, just to say, there may be people online who don't want to read the whole peer-reviewed scientific paper. That, of course, we launched it before that, just the overview. So we, on our website, we have people can look at the overview of the report, and the full report, and the regional reports, of course, for the regions. We've done those, so that might be more user-friendly for most of the people online.
To be honest, I think there's there will be nobody online who really wants to read the comprehensive report. I'm afraid.
Well, you underestimate our audience. Come on, man.
No, but the comprehensive report is just made for those who don't believe. Then they can look in the report and see what kind of methods have been used, and why are we coming to these results. But for those who just trust in us, they can read the short form.
We don't have that much time remaining, but probably 5 minutes or so. But I want to ask both of you, because you have looked at this not just from a Latin America perspective, but from a global perspective. Do you have an example of a country or countries that you would hold up as perhaps a model that's doing these things well? Perhaps one in Latin America, perhaps one, if it's a different country outside of the region, that's maybe a global star. I mean, just so that folks can take a look at what's going on and see that there are positive steps along these lines. What do you think in terms of examples that we could point to?
Well, maybe I'll jump in first. There aren't many countries, I would say, that are really like a global star. They've got it embedded in policy. They're doing this and that. However, there are many countries who have good health promotion policies that includes prevention, and now is including using the wording about self-care, because in a way, health promotion and prevention policies, are really all around self-care as well. But there are countries like, for example, the UK, Australia, through the governments, they have self-care blueprints or self-care policies. Canada's looking at that. And then we know about Brazil and Mexico, for example. There are quite a few countries in Africa, like Uganda, Senegal, Kenya, Nigeria, who have taken the WHO guidelines for self-care for health and well-being, and the government has put in policies to embrace those, to really implement those guidelines. And those guidelines originally in 2019, first of all, it was great the WHO brought out guidelines, because it's very important to have guidelines for governments to get the ball rolling. They were focused on sexual and reproductive health, particularly in Africa, because the issues there are so widespread, and there's not much help or medical care, etc. But now a new iteration is coming out next year, but there was the consolidated guidelines of 2022, and really enlarging to include NCDs. So I would say there are pockets around the world, Eric, but there's no one country, I would say, that they are the star. So that's why we want a resolution.
Yeah, yeah, fair point. Dr. May, would you agree with that?
Yeah, I totally agree. But looking, I mentioned the incentives. Looking from the incentive, from the economic perspective, I would rather say that the Anglo-Saxonian countries, the UK, Scotland, Ireland, but also New Zealand, for example, are better than many others. They at least they have realized the role of self-care on a political level. So they are far beyond us in Germany, for example, or in France. And they have realized this, and they try to find right concepts like pharmacy first, things like these concepts which they are running there. And therefore, I think these are quite good examples. You also find good examples in Switzerland. Another issue might be how progressive countries are with regard to switches, releasing products from the RX status. Then we have again New Zealand, the UK. In this case, it's also Germany. That's one aspect. But yeah, there is no, Finland, maybe some countries which on a political level are committed to a self-care policy. This is a first very important step. We didn't do this in many other European countries and other countries of the world, because this simple story that we have been discussing is not well known in the heads of policymakers. I mean, it's very simple. You just need 5 minutes to explain the issue. Today I needed a little bit more, but I showed too many figures. But normally it can be done in 5 minutes, and then you realize the potential. But my personal experience from the last 10 or even 20 years is that almost nobody in the healthcare sector in many countries is aware of the role of self-care, or the possible role, and that's an issue.
It's a really important point, and both of you have brought it right to the fore. You know, this whole issue, I'm no expert in these topics, as is very clear, but it really brought it home to me, going back to the COVID pandemic in Latin America, which was hit harder than any other country, any other region in the world from the pandemic in terms of per capita deaths, and there are reasons for that. But it was a human and economic disaster in Latin America and the Caribbean. And one of the things we found was just basic steps like washing your hands, people had to be re-educated about some of these issues. And then there were countries where things like soap weren't readily available to some communities. And so we see, some of the issues that you highlighted in terms of accessibility and equity and fairness and then basic education. And so some of the things that maybe we would think are common sense or what have you, you need that constant re-education, that constant reaffirmation of human behavior. And I think it's just so important that we bring these topics to the table, particularly in the Latin American, Caribbean context, because again, we've seen in real time what happens when that's not the case, and people die. And it's really a horrible scenario. Fortunately and thankfully, we're coming out of that crisis, but there will be another pandemic at some point. Hopefully we've learned some lessons and we won't be affected as significantly as we were. Well, I guess that's in the future. That's for another conversation. I hope Judy, you and Uwe will both come back. This has been a fascinating conversation. I feel we've only begun the conversation, and maybe that's appropriate because we're only at the beginning of Self-Care Month, but we do have a lot more to discuss going forward. You've been very generous with your time, with your insights, and I just want to thank both of you. I also want to thank our team here at the Council of the Americas, Maria Despradel, for doing fabulous work on the substance of our healthcare dialogues. I also want to thank the team behind this activity today, Hector and Guillermo, Jorge, the whole team that actually puts the technology together and allows us to bring you this program from a multi-continent perspective. It's amazing what technology can do. Yeah. This is actually incredible if you think about it. We'll have the opportunity to do that again. Unfortunately, we're past our allotted time, so we're going to close the program here. But as I say, please come back. Please stay engaged with us. And those of you who have been on with us for the last hour, thank you for your time. To the extent you want more information, feel free to be in contact with us. We'd be happy to provide what we can. Thanks, everybody. Hope to see you again soon at the Council of the Americas.